Yes.
Today is the last day we should have with such a background.
That's what I was saying.
You guys,
It's so there.
you know
I
people.
was saying, where is the covering? Where is the, that's what I was
You have an entire department.
That's what I was
An
saying.
entire department.
I say that the moment I said that, yeah.
This background, it's like even in months I was better. Huh? Ish.
In this, they needed to have something laid on the tables, and that's what I was saying.
I have too many departments. Yes, I changed some things I want to tell you. Let me tell you what I changed here before. Here I did. I say contention at when it's already changed. One, then another one. Here. This one I added.
Okay. Okay. Yeah, that's right.
Then I also added just
intention added famous next to what it is. You added that one.
And no, not here. I didn't do anything. There was
The number of persons getting boosted is inspiring, so let's continue on this poster.
What's up with you now?
Thank you all for attention. God bless.
I can have your pen. I just sign.
I carried your pen used from the airport to sign.
Okay. No, I thought you were waiting for him. Yeah.
That's yours.
Okay, thank you. There was also another point I could not pronounce. That is, it was the name, bacteria, something called bacteria something.
Oh.
team led by the Permanent Secretary in charge of Technical Services, Professor Lakson Kasonka. And there's Dr. Alex Makupe, who's Clinical Care and Diagnostic Services Director. There's also Dr. Andrew Slumes, who's in charge of Public Health. And then on the immediate right of the Honorable Minister, we have Professor Lloyd Mlenga, who's in charge of infectious diseases. And last but not the least, we have Dr. Kunda Msonda, who's the acting Director General at the Zambia National Public Health Institute. May I now take this opportunity to invite the Honorable Minister of Health, Honorable Suli Masebo, to give us the updates.
Thank you. Members of the press, countrymen and women, good afternoon. I'm delighted to note the sustained downward trend in key aspects of the fourth COVID-19 wave in Zambia. This includes continued reduction in the number of new COVID-19 cases and hospitalizations, showing that we are on a positive path towards resolution of the fourth wave. In the past week, we recorded a total of 5,498 new cases and 35 deaths. This marks a 58% and 27% reduction, respectively, compared to last week's recorded numbers of 13,228 cases and 48 deaths. We have also continued to see an overall reduction in the positivity rate, which fell to below 20% and dropped to the week's lowest at 11% yesterday. Similarly, the overall number of new admissions also dropped by 39% from 294 to 178 over the last week. Members of the press, countrymen and women, while the current trajectory is encouraging, we must remain cautious and adhere to all public health measures, as the fourth wave is not yet over, and a flare-up in cases can occur at any time if we drop the guard. We must also not forget that as long as pockets of circulating SARS-CoV-2 virus remain, the chances of the virus changing its characteristics remains high. It is for this reason that we continue to emphasize the need for each one of us to remain compliant to all the public health and social measures we commonly refer to as the 5 golden rules, as well as vaccination against COVID-19. These public health and social measures are not only effective in preventing COVID-19, but also work for preventing and controlling other respiratory diseases, eye infections and food diseases, and waterborne diseases such as cholera, typhoid, and dysentery. In this season, when we're experiencing heavy downpours and flooding in some parts of our country, leading to contamination of some of our food, there's a risk, I beg your pardon. In this season, when we're experiencing heavy downpours and flooding in some parts of our country, leading to contamination of some water sources, our populations are at increased risk of these diarrheal diseases. In view of the aforementioned, today I will focus on our cholera control programs in Zambia. Members of the press, countrymen and women, Zambia is one of the countries in the sub-Saharan Africa frequently affected by cholera. The first time we experienced a cholera outbreak was in 1977 in Pulungu district. Between 1977 and 2019, the country has experienced 31 cholera outbreaks, with a cumulative total of 106,713 cases and 4,367 deaths recorded. The last major outbreak in the country occurred from the hot, dry season of 2017 and to the second quarter of 2018. A major intervention employed was vaccination of the population in selected hotspots against cholera. This intervention yielded good results. However, this intervention, though yielded the intended outcome in that level of immunity, was built in that the immunity was built in the population. And since then, we have not had a major outbreak. However, let me be clear that cholera vaccination is only a stopgap measure, and we must continue to address the fundamental issues of ensuring that all our people must have clean access to water supply and sanitation services. I'm happy to note that His Excellency, the President of Zambia, Mr. Hakainde Hichilema, created a new ministry to address this water and sanitation challenge in our country. Members of the press, ladies and gentlemen, Zambia subscribes to the Global Task Force on Cholera Control, known as GTFCC initiative, which was launched in 2017, which was aimed at ending cholera in the world. The objective of this initiative, which was dubbed Ending Cholera, a Global Roadmap to 2030, is to reduce the number of deaths due to cholera by 90% globally and eliminate the disease in at least 20 countries by 2030. We are working towards ensuring that Zambia becomes one of the countries by 2030. As a country, we have taken leadership and have been instrumental in pushing the agenda to eliminate cholera globally. In this regard, at the 71st World Health Assembly in 2018, Zambia co-sponsored a resolution to eliminate cholera globally by 2030. Furthermore, we took a bold and ambitious step to establish a national legacy goal to eliminate cholera in the country, not by 2030, but by 2025. In this vein, the country developed the National Multi-Sectorial Cholera Elimination Plan of 2019 to 2025, which is known as the MCEP, which outlines strategies towards this goal. Implementation of this plan is coordinated by our National Health Security Agency, which is the Zambia National Public Health Institute, known as ZNPHI. It is also worth noting that Zambia is one of the only 4 countries selected to receive support through the GTFCC's Country Support Plan, which is known as CSP initiative. This was in recognition of the efforts that Zambia has demonstrated in the fight against cholera. Furthermore, the Secretariat of the GTFCC visited Zambia last year in October to appreciate how the country has managed to make so much progress towards elimination more than many other countries. It is very clear that Zambia is regarded as a pioneer and champion in the cholera fight globally. Therefore, we have to continue shining as an example through comprehensive implementation of the Multi-Cholera Elimination Plan, MCEP. Members of the press, countrymen and women, while we have not recorded any cholera outbreaks since the COVID-19 pandemic started, global statistics show that meeting the 2030 target of reducing cholera deaths by 90% will require stepping up the fight against cholera, particularly in sub-Saharan Africa, even amid the pandemic. Sadly, the COVID-19 pandemic may have had a negative effect on key cholera control components such as surveillance, which is a key measure against cholera outbreak and associated deaths. Effective surveillance is needed to detect Vibrio cholerae, the bacterium that causes cholera, early in clinical, environmental, or foodstuffs. Members of the press, countrymen and women, the COVID-19 pandemic has increased pressure on health systems. In cholera epidemic countries like Zambia, it could be very devastating if a cholera outbreak was to occur simultaneously with COVID-19. It is for this reason that the UPND-led government, under the leadership of His Excellency the President, Mr. Hakainde Hichilema, recognizes the need to step up cholera prevention and preparedness activities to avert any possible cholera outbreaks. We shall in the near future outline some of these activities, these actions, as we complete discussions with the World Health Organization. Members of the press, countrymen and women, following the identification of the cholera hotspots in the country, we commenced vaccination campaigns. In 2020, Zambia received a total of 5.6 million doses of the oral cholera vaccine to vaccinate 2.1 million people in 11 hotspot districts. In December 2020, we started countrywide oral cholera vaccinations in the identified hotspots districts. As of 23rd January 2022, this year, a total of 1,266,394 people were fully vaccinated, giving over 95% coverage in 8 out of the 11 hotspot districts. These districts are Nsama District, Chienge District, Nchelenge District, Shibuyunji District, Kabwe District, Katpiri-Mposhi District, Ngambwe, and Mazabuka districts. As this effort continues, we shall start to vaccinate Lusaka District on the 14th of February 2022. Then we'll move to Snazongwe, Chongwe, and Monze districts. You may be interested to note that we have also been working with the international community in conducting research to generate local evidence to guide the effective implementation of the global cholera elimination strategy. I wish to inform the nation that we just concluded data collection in a study conducted in Nsama District and Shibuyunji districts, which is looking at the feasibility and benefits of using oral cholera vaccines outside the cold chain. This is important, particularly in resource-constrained areas such as rural areas where availability of refrigeration facilities is often a challenge. Once analysis is completed, results will be shared widely. As cholera elimination is a multifaceted issue, we have also been working closely with other government line ministries, agencies, development partners, civil society organizations, and the private sector to improve water supply and sanitation across the country. This effort will be further boosted with the significant resources which have been allocated in this year's budget towards water, sanitation, and infrastructure, not just in the Ministry of Water and Sanitation, but also in other sector ministries. Members of the press, countrymen and women, before I leave this subject, let me remind you of the simple and easy cholera prevention and control measures that we must all continue to observe. 1, make sure to drink and use safe water, which has been either chlorinated or boiled. Secondly, wash your hands frequently with soap and safe water, especially when handling food and after using the toilet. Thirdly, use a toilet or latrines and always ensure that you have soap and tissue paper in every toilet facility. 4, cook food well, keep it covered, and eat it hot. Thoroughly clean and peel your fruits and vegetables. 5, maintain a clean environment. Remember the adage, cleanliness is next to godliness. 6, which is lastly but not the least, seek medical attention urgently when presenting with symptoms including diarrhea and vomiting. Members of the press, countrymen and women, I will now update you on the COVID-19 situation in the country. In the last 24 hours, we recorded 294 new COVID-19 cases out of 2,119 tests conducted countrywide, giving an overall national positivity of 14%. We note a continued drop in the positivity at provincial level, with Copperbelt, Luapula Province, Lusaka Province, and Southern Province all recording single-digit positivity, and Northern reporting 0% positivity from the tests conducted there. This is a very encouraging development, and it is an indicator that community transmission is being brought under control. Well done, gentlemen, both on my left and right, and all those in the provinces. Central and Eastern provinces, however, do continue to record higher positivity levels, which are at 44% and 30% respectively. And our teams are on the ground to ensure that the two provinces successfully reduce their positivity as well. We admitted 18 new patients in the last 24 hours, the majority of whom were from Eastern Province. On the other hand, we discharged 1,341 patients from both home management and facility, leaving 5,439 active cases countrywide. Of the current active cases, 114, which amounts to 2%, are admitted to hospital, with 40, which translates to 35%, on oxygen therapy, and 10, which amounts to 9%, classified as critically ill. The proportion of unvaccinated patients among the admissions currently stands at 93%. With the reduction in admissions noted, we are seeing that an even larger proportion now that continue to require hospitalization are those unvaccinated. On a sad note, we report 5 new deaths in the last 24 hours, including a 3-month-old baby. The other 4 were adults with ages ranging from 39 years to 86 years old. Of these, 3 were classified as COVID-19 associated deaths, and the other 2 as COVID-19 deaths. Positively, we note continued increase in the numbers of individuals getting vaccinated, including children between the ages of 12 to 17 years, with some having gotten their full vaccination before returning to school today for the new term that opened. I wish to remind parents and guardians that the dosage regime for children requires that they receive their second dose vaccination within 3 weeks of their first dose. The number of persons getting boosters is also inspiring. Please, let's continue on this positivity path. Members of the press, countrymen and women, allow me to re-emphasize that the interventions to successfully prevent and control COVID-19 remain the same, which include compliance to the 5 golden rules and getting fully vaccinated against COVID-19. I thank you for your attention, and may God bless you all. Thank you.
Countrymen and women, that is Honorable Minister of Health, Honorable Team Manager from Cholera and the COVID-19 pandemic. Honorable Minister, allow me to invite the media for clarification. Allow me questions in the room. Come to the microphone.
Good afternoon, Malikana Munene from Spring TV. I would like to find out, in the last week or so, the number of tests that have been conducted are still quite low, with the highest being about 12,000 last week. When exactly are the test kits going to arrive? And secondly, there has been a low turnout of adults receiving the COVID-19 booster vaccine, with the average being from 200 to 700 last week. And most members of the public that I have interacted with personally are unaware of this booster shot that is being given. What are you doing to bridge the information gap? Lastly, there has been also a reduction in the number of active cases from about 10 to 11,000 2 weeks ago to 5,000 today. What can this be attributed to? Thank you.
Honorable Minister, the technical team, I invite you to respond to those three questions.
Okay. Let me start with the last one. That there's been a reduction in the numbers. Was this numbers of tests or numbers of people getting affected by COVID? Active cases have reduced. Well, I can only say that this is as a result of people following the 5 golden rules, and also more people getting vaccinated. I think that is the first. But also, I think that the weather patterns does also influence. We normally see that when you are in a cold season, these rates are high. And when you're in a warm season, these also get to improve. I think I would also attribute it to the good works that is being done by the professionals in the Ministry of Health and the support that we are getting from members of the press in terms of information dissemination, but also the traditional authorities and the donors and many other partners that have really come on board in to support this. Not forget the multi-sectorial efforts of this government, which is chaired by Her Honor the Vice President. This is what I would really attribute this reduction. The second question was to do with the boosters, that the numbers from 200, 700 a week, and you feel that these numbers are not good, and what are we doing to... It is true to say that, and you've said it correctly yourself, that the information has not been enough countrywide to those that have already, or those that are fully vaccinated. And I think that we ourselves in the ministry have been underplaying that. Maybe it is also deliberate, because we need to ensure also that the primary vaccination is what we've been concentrating on. We need to get to a point where before June, at least 70% of our citizens, those that are eligible to get a vaccination, should get the vaccination. We also know that once you are vaccinated, fully vaccinated, the way you and I who are present here today are fully vaccinated, it's not a problem to get us to go for a booster. The challenge is still with those that are going to be first-timers. Those are the ones that we still have to convince. So really, for the boosters, I think it's a question of information, and I hope that you yourselves as members of the press will continue to do the good job that you're doing in disseminating information, and especially not just in English, but in all the other languages, so that even those who are in the rural areas. I know for a fact that Lusaka, Copper Belt, most people know, and most people are beginning to access. Others are taking time, even as they know. They still feel that maybe they're safe. And we also have another group of people that think, yes, I need a booster, but let me just wait a minute. So, yeah, I think that, but as a ministry, we are not anxious about these boosters to the extent that it should worry us. We think that the response so far, slow as it may look, it's good enough. And we know that by mid-June, this should not really be an issue. On the test kits, I am happy to inform you that last week we did receive 75,000 kits, and we are also still expecting another 400,000 this week. And so the issue of test kits will not be an issue. But this does not mean because we are receiving these kits, therefore we are going to continue with indiscriminate kind of testing. No. The policy still remains the same. Am I right, Parliament Secretary? Yes. Am I right? Yeah, I think so. So we did not reduce or change policy on this score because of lack of test kits. No. It is a policy that we are driving even with the receipt of all these test kits that we have in the country. And also let me use this opportunity again once more to thank the Chinese government who today were able to receive 400,000 vaccines of the 1 million that was donated to us. And again, the recipient of 400,000 today is an agreement that we must receive these in a phased approach, because we do have sufficient to drive the process of vaccination countrywide. Thank you. Yes, would you like to add anything on the issues that have been raised?
Precisely, all the minister, you've said it all. We are under no stress regarding test kits. We have planned and prepared. As you know, COVID has affected a lot of things, including supply chain, but nevertheless, everything has been done in a way that there will not be a time when we shall run out of test kits. Again, like the minister informed in the last week in our press conference, we should not just test for the sake of testing, because people at some point got excited and just started coming through for testing every 2 days. You would see that would be a waste of resources, and the minister has always insisted that we are dealing not only with COVID, we are dealing with potentially other conditions that may arise. You can see in today's update, the minister paid a lot of attention to cholera. It's another condition that we have received repeatedly in years, and we have kept vigil that should any evidence of cholera show face, we'll go full throttle for it as well, in the same spirit that we've done with COVID. So we're sparing all the available resources to see that we test every potential epidemic that may arise, not even forgetting malaria, which is still around. So it's a question of leveraging the resources. I was expecting the members of the press to ask about what is happening or obtaining elsewhere in the world. You heard in the UK, there's the Prime Minister has encouraged or suspended measures that we are still applying in Zambia, and that we should not make comparison with the United Kingdom, that we are at different levels of vaccination, for example. And this is what the minister has always been saying, that if we should get vaccination to the level that it is in UK, probably we should also get to a point where we'll get away with some of these measures that we have relied upon. But for now, let's continue masking, let's continue hand washing, let's maintain social distancing, and most importantly, let's continue the drive for the vaccination, so that by June this year, only five months left, by June this year we shall be able to attain a herd immunity of not least 70%. We shall give confidence to the minister also to announce in the same way that the Prime Minister of Britain did, to scale down on these other stringent measures. The drive for the booster probably also could have been seen to have taken slow pace, because remember, the vaccination coverage, the primary vaccination coverage for our population was very low. So what could have happened now is that all those that were primarily vaccinated have gotten their booster, or most of them. Now it is waiting for the many others who acquired their vaccination in the last 1 month. Remember, we launched a campaign to get 2 million doses in people's shoulders before Christmas. So the critical mass of the people that responded to that call are still waiting for their booster. And when their time comes, when they should be eligible for the booster, you will see that the numbers for the booster response will steeply rise, because then people are eligible for the booster. Thank you, Honourable Minister. Otherwise, everything has been said.
Professor, you want to say anything from your side over these questions? Yes.
Thank you, Honourable Minister. You really emphasized the importance of engaging the community, more especially through the media, to support primarily the initial series of the vaccines, as opposed to giving more preference or more highlights on the booster. Over the stock status, over the kits, Honourable Minister, we have, as the PS has mentioned, enough kits for now, and the policy to test is based on the status of the epidemic. We are also expecting another 1 million PCR test kits, as you know, besides the rapid kits, which we had some challenges with a few weeks ago. We still rely on the PCR as well for many cases, and we are receiving 1 million test kits as well for PCR. So the testing platform is going to be expanded still, but again, only those that are eligible for testing are the ones that are going to be vaccinated, tested for COVID, not using mass testing as a way of monitoring the pandemic or the progress of the pandemic. Thank you, Honourable Minister.
Thank you very much. I'd like, Doc, for you to look at the issue of reduction. Why the reduction? What are the factors that are pushing this reduction from your technical point of view as Zambia National Public Health Institute?
Thank you very much, Honourable Minister. Yes, indeed, we have been keeping a close eye on the way that the pandemic has been evolving over time, and clearly we are seeing this sustained and gradual decline in the positivity and other parameters that we measure, the number of hospitalizations, the number of deaths. So as was highlighted already earlier, it's a combination of factors. So we take this opportunity, Honourable Minister, to thank the public who have been very compliant, and they have been with us in terms of following those public health and social measures that are meant to protect all of us, and also taking that individual responsibility to play our part. So it's a combination of the response from the public in terms of following the measures that are put in place, but we also see the effect of vaccination. Consistently, we have demonstrated, even through your press briefs, Honourable Minister, that we are seeing those who are not vaccinated as being the more affected. So we see that the more people are getting vaccinated, even the number of cases, particularly those who are severely affected, tends to be going down. So we did mention in the statement today, Honourable Minister, there are still a few hotspots here and there where the positivity is a bit on the higher side compared to the rest of the country. We are investigating these thoroughly, and we have identified these specific districts and hotspots within those provinces, and our teams are looking at what could be the factors that are driving those slightly higher numbers in those places. However, we see that the public have been very, very supportive, and this is commendable. We see also the effect of the vaccination. You did allude, Honorable Minister, to the issue of the temperatures and the weather. Yes, this has been noted not only here in Zambia, but in other places globally, and we think that might also contribute. So we also see that during the course of a pandemic, as the progression goes, we have less and less people who are susceptible to getting the infection, especially if the same variant of the virus remains for some time, and so that could also be another factor. However, we still remain cautious. We are not yet out of the woods. We still need to continue with these measures, and each one of us taking personal responsibility to ensure that we protect ourselves and also protect those around us, our loved ones, our colleagues, and associates. Thank you, Honorable Minister.
Thank you. Numbers, Professor. What can you add to reduce numbers?
Minister, I think the point Dr. Msondo mentions of the pandemic itself, when you compare the 4 waves we have had, the 4th wave has been the one which has at the highest peak, even higher than the Delta wave. Of course, severity has not been the same. It's been less severe compared to the 3rd wave when we had the Delta. But because it has also now affected possibly more than 80% or so individuals were infected. What we've been reporting are those that have been testing, and especially that we have had also the policy to test those that are symptomatic. So with that, we expected a smaller pool of individuals who were not exposed, and as a result, you have a larger population who have had some sort of immunity from exposure itself, but combined with the vaccine as well. So that's driving, again, the epidemic down, because you have fewer people who need to be infected. Another point also which we need to highlight, Honorable Minister, is that as long as we have this pool of people who are not vaccinated, and you can have another new variant. There is a concern from Europe already of the BA2, and it's also one of the rising variants. It could be a sub-variant of the same Omicron, and it's possible even for us, if we do not continue emphasizing the measures, the prevention measures, we can have another mutation which can happen from the same variants which we have had. So we need to emphasize the prevention still, even as the cases are going down. Thank you, Honorable Minister.
I think there's a very big point there, which I'd like us to take issue with, and that's the point that even with these cases going down, there's a possibility that if our populations remain unvaccinated, we could all end up getting affected by another variant, which I'm being told could be a sub-variant of the Omicron. So it means that our message as a ministry to our people out there is that even with the variant, with the problem of Omicron going down, this is the time that now we must be on guard, but not being more on guard by the 5 golden rules, but by vaccination. I think vaccination, therefore, remains the only key way to ensure that as a country we can get away and begin to do what others are doing, like in the UK. UK have laxed their guard because they are over 90, over 80% of the nations are vaccinated. But what about us? We are still below 20%, or we are now at 20%.
We are now at 20%.
We are now at 20%, so just at 20% is as bad. If we can start getting over 30% going up, then we'll be saying, yes, we're talking. But once you're just at 20% of the eligible people that are supposed to be vaccinated, it still puts you in an awkward position, and therefore you can't relax, your guard against contracting COVID-19. Thank you.
Countrymen and women, as we draw closer to the end of our budget, we have continued to receive support from various partners or stakeholders who've come on board to help to fight against the pandemic. So today we have Honorable Minister, the Prime Africa and Manaus International Senior Competition Manager, Mr. Jonathan Nkata, who's here with his team to give a presentation towards the fight against COVID, but this is specifically towards the COVID vaccination drive. Mr. Nkata, can you please come forward and give us a brief presentation?
The Honorable Minister, the Permanent Secretary, Directors of the Ministry of Health, the Executive Director of Vaccines, Managing Director of Prism Africa, and representatives from Manaus. All government officials present, the press, distinguished guests, ladies and gentlemen. We have an initiative which is called the Zambia COVID-19 competition, an initiative that has been born out of the volunteers under the District HIV Committee, Dutch, and adopted by Manaus Investment, King Outreach, and Prism Africa. These three entities have managed to pull into this competition roughly about 300,000 kwacha to address or encourage the intake of vaccination. So the project is a direct response to the call of the President, Mr. Hakainde Hichilema, and the ministry for the call for the community to join the fight against COVID-19. The competition is a community initiative aimed to supporting and recognizing government and society's efforts in the fight of the COVID-19 pandemic. The competition is also recognizes the vaccinated and amplifies their visibility and creates a platform for them to engage with each other and have a conversation. Today we also have one of our winners from one of our draws, Mr. Andrew Moyo. I think there's a bed outside there, some of us have seen it. The program is a TV program which runs on Prism Africa under the Topstar and the Movie TV decoders. That's channel 96 and channel 9. It's a 30-minute program where the vaccinated call in, they're able to express themselves and guide the conversation as opposed to the unvaccinated guiding the conversation. That's an important part of this whole exercise. So meaning that most of the viewers are able to see and get feedback from the vaccinated people. We've had participation into this particular program from all the 10 provinces. We're glad to say that. And we want and see that government also tries to support such initiatives because we are able to reach out to more people. The success of highlighting the vaccinated people is very important in such cases of COVID-19 because they also impact on the future vaccination programs. For example, if the journalists were getting negative news from the vaccinated people, it would be a challenge for this drive. But the good news is that every journalist, every media house is getting a positive response. So most of the negative responses are coming from the unvaccinated and from social media. So we think government support to such initiative will help us encourage ourselves at community level, enhance participation, enhance the conversation on vaccination, and therefore lead to more people participating in it. We are also glad that Latkins outreach program has gone further to draw the competition and take it to the community by giving us an operating community office in Cholera, where now we'll be planning for activities, giveaway activities again in vaccination centers, marketplaces, and bus stations where the vaccinated people using the same concept of giveaways to encourage and recognize the efforts that the vaccinated people are doing. We think they are a voice to be heard, and they should be given a big space in this whole campaign. Honorable Minister, ladies and gentlemen, I would like to thank the Ministry for showing interest and accepting our request of partnership for this particular competition. We hope such partnerships will be able to sustain and benefit the public. To be sustained and benefit the public. Thank you very much for your time.
Thank you very much. I like this.
Honorable Minister, I invite you to comment or react to the statement before you hand over the bed to the beneficiaries, or rather the winner of the competition.
Oh, they will be a winner? Already?
Yes.
Okay, that's nice. I hope I can be the winner. But anyway, I want to thank you for your great initiative, and I think that is what we need if we are to drive the uptake of vaccination to a better level. It is very important that an initiative such as this one, which actually gets those that have been vaccinated to be showcased and for people to be able to see them. There are so many myths and misconceptions, just misinformation generally, that if you get vaccinated, if you're a man, you stop functioning. If you're a woman, this is what will happen. All this spiritual misinterpretation of the Bible, and so on and so forth. So it's important that we start showing those that have been vaccinated. And I think that those that have been vaccinated have not been given a platform, to speak out. But let me just ask that when you are displaying those that have been vaccinated, include the new category, those that have gotten their booster vaccination, and also the children that have been vaccinated. I think it will help people, especially parents, to see that really it's just like another vaccination. We've been talking about cholera vaccination, and you've been told that the last time this country experienced cholera outbreak was in 2017 and the second half of 2018. And from that time to date, even with so many floods, the cases of cholera have all been almost zero. Again, this shows that the cholera vaccine played a big role. So I think it's important that we get support from the private sector, from the civil society, such as what has just been demonstrated, and I'm very, very happy with that. And thank you very much. God bless you.
May I now invite you to hand over the bed outside?
Outside? Okay, thank you.